Hi, I'm Dr. Chris Burritt. Welcome to the ACO's A Different Kind of Psychiatry case presentation webinar. We're glad to have you. Today's presentation is entitled Beyond Tantrums, Connecting with a Troubled 3-Year-Old, and it's presented by Dr. Alberto Foglia.
Hi, Dr. Burritt. Hi to everybody. I'm very glad to be here.
Welcome.
Thank you.
Dr. Alberto Foglia is a board certified in psychiatry by the Swiss Board of Psychiatry and in medical orgonomy by the American College of Orgonomy. He has a medical orgone therapy practice in Lugano, Switzerland, where he treats infants, children, and adults. He has written several articles about medicine, psychiatry, and orgonomy in a variety of scientific journals, including the Journal of Orgonomy. Now, before we begin, I just want to remind the audience that at any time during the presentation, you can type in questions into the Q&A section. We'll get to those at the end. So Dr. Foglia, this is a really exciting presentation. I'm excited to hear it, but before we start, maybe you can just let us know, how did you decide to present this 3-year-old and her treatment?
So I decided to present this case because it shows very simply and very clearly one of the most important discoveries of Reich in the psychic realm, that is the distinction between primary and secondary emotion, behavior, and instincts. And in this child, you can see the transformation from primary, soft, loving impulses into secondary, harsh, and destructive, irrational impulses.
Very
It's
important.
a good example.
Yeah. So set the stage for us, Dr. Foglia. How did she come under your care?
She was brought to me by her mother. Her mother is a patient of mine, and the daughter, 3-year-old, Aline, she was having, since the age of 2, temper tantrums, a lot of them, sleeping problems, agitation, moodiness, and also a particular behavior that upset her mother rightly. She was doing the clown with everybody, and everybody laughed at her. The mother found that too much and not nice, and she was right.
So the mother had some sense that this silly behavior, there was something more to it than just being silly and having fun.
Exactly. It was too much. And also the temper tantrum, they were really violent.
I see.
Violent, yeah.
And so how did treatment begin?
So she brought her daughter to me, and I usually see the children in the treatment room, on the treatment couch, the mother sitting in a chair nearby. And using this tool, the treatment couch, it's very effective for everybody, but most of all for pre-verbal children. There you can see right away they state how they feel, how they are doing. So
it reveals...
That reveals what they have inside. Usually, healthy, happy children have no problem being put on the couch in front of an unknown adult like I am. So they look at me, they stare at me. I always say they scan me. They can stand minutes looking at me like that, and I like that very much.
Who is this doctor? Yeah.
Yes, who is this element? And they show a central feeling, which is trust. And this trust can be dangerous for them. If they meet something bad around them, then they can be crushed. So disturbed children are not so easy. They don't want to lie down. They don't want to separate from their mother. They fight with me. They don't look at me. So we will see if we discuss about Aline, how she did.
So yeah, let's get into it. How did Aline present on her first appointment?
Well, she was special. She is special. She lied down and she was perfect. She looked at me, she stared at me, she smiled at me. She did everything I asked her. Looking the light pen, making faces, kicking, hitting. She was very participating and very curious. So it seems that she had no problems. But she had a problem. She didn't have voice. No voice. I asked her to make she had no voice. She tried. She didn't have voice. So we worked on that. We worked on her voice. At the end of the session, I told her, okay, you can go back to your mom. She went back to her mom and she made the clown. And this was the first session. The clown was really silly, not nice to see.
So it wasn't there until she returned to her mother at the end of the session.
Exactly.
Let me see.
So the second session, she is not that participating. She is not that happy to lie down on the couch, but she has voice. So she does everything wonderful. She showed me that she has voice. And I have to say that at the end of the session, after we made everything, making faces, kicking, hitting, yelling, she went back to her mother and didn't make this clown.
Now, are there thoughts or feelings you have, even initially at this second session?
Not yet. I was happy to see that she didn't do the clown. So at the third session, it was interesting what her mother told me, that she didn't do the clown anymore. She didn't do temper tantrum anymore. With the voice, she liberated something. She slept much better. She was lesser moody, but she was clinging to her. So things changed completely. And the session was revealing. So we made like every time. She was curious again. She was participating again. She looked at me, stared at me for minutes, yelled, kicked, looked at the pen, was very interested. And at the end, I told her, okay, Aline, we are ready. You can go back to her mom. And she did what many little children do at the end of session, stretching their hand and their arms and looking at their mother and going to their mother on the lap, hugging them in a very soft, loving way. It's always very nice to see this reaction, this reflex of the little children at the end of the session. So Aline was beginning to do the same. She stretched her arms, she longed to her mother, and suddenly, in a few seconds, she became harsh. She commanded her mother, "Now, come." She was aggressive, destructive. She was commanding her mother to come to take her from the couch. It was really interesting to see.
Dr. Foglia, so you're saying she's lying there on the couch with her arms outstretched, longing for her mother, and before her mother approached her or before they came together, it switched?
It switched in a few seconds, and she began to yell, "Now, come." No, she was 3-year-old, so she didn't speak very well, but you could understand that she was commanding her mother to come to take her. The mother felt rightly that this was not good. This was harsh. It was commanding, authoritarian. She didn't want to give in to this behavior, rightly. And she said, "No, in this way, I don't take you." And Aline began one of her tantrums on the couch, there with me. It lasted half an hour, yelling, pegging, fighting for half an hour. At the end, she calmed down. She reached to her mother and went to her in a loving, soft way. And this was a third session, yes.
Wow.
Yes, very nice. After the third session, mother told me she was much better. She was no longer having tantrums, no longer making the clown, but still clinging. And then this clinging was the second part of the therapy that now we are dealing with. But Aline is completely different than before. Yes.
Wow.
So we could retransform this secondary behavior again in a primary. But without therapy, this would have been fixed, and she would have remained like that. And this is the beginning of the transformation, and the fixing of this transformation into a neurosis, into a harsh character trait.
And really, it almost sounded like she had two possible harsh traits that her natural open longing transformed to. You basically described it as the clowning way of attracting attention and people to come to her, and also that harsh, demanding, authoritarian way.
Yes, you're right. The clown, I think the clown was more a substitute contact. To deal with these two tendencies, she made the clown. The problem is right, she needs a lot of contact, too much. There is this clinging.
Would you say her silly clown was almost her facade on top of her destructive,
Yes. She was already developing a facade.
Yeah.
And secondary layer,
Yeah.
this disruptive, authoritarian, harsh way. So she was developing a character, armor, a neurosis, and these would have been for sure fixed in her. Would have lasted forever.
It's really amazing because what with adults who develop layer after layer after layer after layer, you caught it pretty much right at the genesis of these layers, that secondary layer, that destructive character, and then her facade. Wonderful.
Yes, I was lucky to observe that, and I was hit by that. That's why I want to present this case, because it is a particular case, and it is a particular clear demonstration of this discovery, the distinction between primary and secondary emotion. If you make this distinction in the education of the children, you have an easy task. It helps you enormously. In the past authoritarian education, children were repressed in their primary and their secondary emotion. The consequence was a so-called repressed neurosis. They were all obedient, submitted, a little bit depressed. This was an average human neurotic. Now in this permissive education, you don't repress nothing anymore, not even the secondary emotions. And so we have new neuroses, unsatisfied neuroses, impulsive, violent, difficult to control, and very fragile.
Sometimes we call that the anything goes kind of attitude toward children, society. Yeah.
Yes. And this is not right.
Right.
You have to distinguish between primary, it goes, secondary, it doesn't go. But today you cannot repress anymore. But you have to repress secondary emotion, as we have done with Aline.
So what you're also saying, Dr. Foglia, is we don't need to return to the, quote, good old days of authoritarian repressive education either.
No, it was unhealthy, that too. But today we are only to the other side.
Yes.
There is a nice passage of Steinbeck. Steinbeck said, the church and the bordel, you say, brothel, and the casino.
The church, the boardroom, and the casino?
No, the church and the bordel came into the West together. If the boss knew that they were only two faces of the other, of the same coin, they would horrify. So the new anti-authoritarian education is only the other side, only, of the authoritarian education. And the old nice time, they are only the other face of the today permissive society.
Yeah. So Dr. Foglia, one thing that really stood out to me was her mother was in therapy with you. And I'm curious if every parent is in therapy with you when you see a child, and if not, what you see as being different, because it really stood out to me that the mother really seemed sharp and really clear about what was going on with her daughter. Maybe not that she could address it on her own, but that she was pretty sharp with what was going on.
She was clear, yes.
Yeah.
She understood it. It's a problem. I have learned in the years that it is better to have in treatment children with the mother also in treatment. If not, usually I have mother that call me and ask for children who have problem, and I usually say you should first begin therapy. And most mother accept. And so I begin to treat the mother, and after a while, when I begin to see emotions in the mother and they begin to express emotion, then I tell them, okay, we can start with a child. I don't take any more children without the mother in therapy. It is always a problem. They don't understand what happened. They get into the treatment. They disturb the changing of the child. They don't understand it. So it's not easy.
Yeah, that's been my experience as well, that I have to have a good connection with the parents if they're not in therapy. But even then, sometimes it's just doesn't work as well, if at all, because like you said, they may have their ideas about therapy. They may have some conceptions, but it's not the same if they're not in their own therapy to really feel it.
Yes.
So we have some questions from the audience, and I think this is important. Can you please explain secondary emotions? I think to define that a little bit more clearly for the audience would be good.
Secondary emotions are harsh, destructive, evil emotion. Arrogance, overbearing, authoritarianism, emotions hurting the others. They begin very early, as we have seen in Aline, and then you have to begin to repress them, at least in the past. And then, as you said, you begin the stratification of the character structure.
Almost in some ways, it would be, in a lot of our journal articles, we have this picture, of a circle, and it has someone's nature or core, and you have an impulse, an arrow coming straight out of that. And then you have a larger circle around that one, and you have that arrow going through it and then going off to the side, becoming distorted. And that's what I always visualize when I think of, an impulse, a natural impulse to reach out to mother, for instance, in this example, going through a layer of armor and becoming distorted. And that angle is really that harshness and whatever way that manifests.
I use another metaphor, you say.
Mm-hmm.
A river has to go to the ocean. But if something happens, it is diverted. And this diversion goes destroying the land. It doesn't go in the right path. And this is the secondary deviation of the river.
Mm.
And once it's deviated, it doesn't come back alone. Unfortunately.
Yeah.
But here we see with a little child, you can divert it again in his path with therapy.
And in this case, relatively quickly.
Yes, with little children is very often like that.
Yeah.
What you need 20 years in an adult, you need 4 sessions with a child, with a small child.
Yeah. And just to go back to the idea of parents being in therapy, the child getting better and improving upsets the equilibrium between the parent and the child. And so if the parent isn't in their own therapy, they might not react well to that changing functioning of the child, right?
Yes. For example, now Aline is clinging to her mother, so she's showing that there is a problem, or that it has been a problem with the mother. There has been a problem of contact with the mother, and the mother is ready to face that. It can be hurting for a mother that wants to have the best for her daughter, that something in the contact between them has happened.
So here's a question. Have you also treated a father in therapy in conjunction with the treatment of the mother and child?
Yes, in this case, yes. For 1 year, I have treated also the father. But usually the father is lesser important, I'm sorry. The mother has a biological contact with the daughter. It is much more important. I tell that for experience. I had 2 children in therapy to children of a patient, male, the father of me. And it was not good. The mother, who is important, didn't understand, didn't follow. The children changed a lot, and she couldn't understand that. So she took that as a merit of herself. Oh, I did that, and the children are better. The children were very, very difficult.
Mm.
And so she interrupted therapy.
Mm.
So I don't know nothing anymore of the children.
I see.
Yeah. The mother is more important than the father.
And in Aline's case, did she have siblings, or were there problems with her father or other people in the family?
There is another son, an older son, who is also in therapy with me because of nightmares.
Mm.
He is a wonderful boy, and he wants to come because he tell me his symptom, Dr. Foglia, I'm still a little bit scared. So next session, how is doing? How are you doing? Still a little bit. I would like to get rid of that. And the problem is aggression. He is repressed in his rage. And there too, there is a problem with the mother. And he's learning slowly in therapy to get out his aggression, his natural primary aggression, not secondary. And this is helping him very much.
Yeah, very. Yeah, I think aggression, especially these days, is very confusing is the word that comes up for me for a lot of people. People tend to think of aggression and aggressiveness as a negative, bad thing. And it can be harsh, but not always.
Yes. They don't distinguish between primary and secondary.
Yeah.
And the distinction is not so easy. Somebody has asked how you distinguish them. It's not that easy. Most of all, you feel it. So it's not so easy to explain exactly how it is. When a child is here with me on the couch, I distinguish it because I feel it.
Yeah.
Yeah. And I have a very, very destructive secondary aggression in children with 5, 6, 7 years.
I don't know if this plays out for everybody, but what I've noticed working with young kids especially, but with rage, when it feels, when I don't feel like I'm going to be hurt, I feel better off. It feels like we're closer to their primary aggression rather than this harsh secondary wild.
And children can be, when they are secondary expressing, they can be very wild. They want to destroy my office. They want to pick up my things and throw them around. So I have a hard time putting them together, canalizing the river.
Mm-hmm. Yeah.
Can be a difficult task.
Yes, very much so. Somebody jumped on your comment about 20 years for an adult. So basically, there's no hope for us grown-ups. That was the comment.
I disagree completely with that.
I think you should say more.
You do the same work as with children. You put the river back into his path, into his bed, and it can last 5 years, 10 years, 20, 30, 40. It's very individual. But you do it. You do it. You'll see. You'll see with adults.
What I would add to that, Dr. Foglia, is it's not that nothing happens, then 20 years you're cured. There's this progression where there's more and more contentment with the range of feelings and functioning. And often there's patients who can, not have symptoms, for instance, or feel much better after, a short period of time, but that they have some sense of being able to get more out of life. And so they continue on in therapy to address that. But it's not that they couldn't, some patients do leave after a few years and they feel better, and that's okay for them.
Yes. And there are patients that enjoy every step of the river back in his bed. And there are patients that don't enjoy that because the pain that they have inside is so strong that you have to come to the end to encounter this deep pain and repair it. But meanwhile, they don't have that satisfaction as many others have. Many others have a lot of satisfaction. Their life become much better year after year. So it is really a pleasurable development for them. But not everybody is so fortunate.
Yes.
Even if they react very well to therapy, subjectively, they don't see that.
Yes. It really is just dependent on each individual person, I've noticed. What was behind the clinginess? Can you say anything more about the clinginess in Aline?
So I saw Aline only another session, more than I told you. And I don't know yet. I suspect that there have been a problem in the contact with the mother. Something in the character of the mother that therapy didn't take away completely. She is much better, but she still has this particular trait, say a little bit harshness. And a sensible daughter like Aline has sensed that and has suffered of that. Mm-hmm. So we will have to deal with that.
Yes.
Yeah.
And here's another question. What about the 2- and 3-year-olds who are bossy and act like little kings or queens, what people unfortunately call the terrible 2s or terrible 3s? Is this not a healthy stage that should be treated with gentle tolerance?
I didn't understand the question.
People categorize sometimes the all too common terrible 2s or terrible 3s when children are being bossy and acting like little kings or little queens, and it's all about me and I want my way, and they can be very oppositional and aggressive at times.
I laugh because I remember a 2-year-old boy that they brought to me because of that. He came into the treatment room and he didn't want to do nothing. He took the chair he went out from the bed, 2-year-old. He took the chair, which is bigger than him, and he began, no, like that. He didn't want to do nothing. I asked him to do it. It was wonderful. So this was a bossy little child. I called him Mussolini.
Wow.
Yes. And you have to make them surrender to you. They have to do whatever you're asking them, and you can wait for sessions after session. They make temper tantrum on the couch, on the treatment couch. They don't want to do whatever you ask them to do, and they can stand you for. I have a record. A child, a girl. Made a tantrum on the treatment couch for 2 hours. I could not go away. If I would have gone away, I would have lost the battle. She would have had the sense that she's stronger than me. After 2 hours, she surrendered. And she did what I had to ask her to do. Rolling her eyes, following the pen. That's it. And then she changed completely. She is now still a patient of mine. She is now 8-year-old, and she called me. Can I come to therapy? I need to talk to you about that and that.
Wow.
Yes, wonderful.
Wow.
And she was tremendous.
So I guess what I would add, though, is that I don't want someone to hear what you just said and feel like they have to break in the 2-year-old or 3-year-old and like a wild horse, that they need to dominate the situation, because often I think how things get to that point is a lack of perception of the child's needs at that age.
Yes.
That's how it comes to a head.
I don't know if I give that impression. If I canalize the rage or the temper tantrum, I never do it harsh. I do it strong, but not harsh, never harsh. I am not moralistic with the child. I'm not telling him this is wrong. I'm telling him I want you to roll your eyes. I just want that, and I need with the girl that I told you with my record, I need 3 years.
Yeah.
So you cannot be harsh, or you will do what the old authoritarian way was.
Yeah.
To repress everything. In between these temper, there is a lot of secondary emotion, but there are also the primary emotion hidden underneath.
Right.
So you have to be careful not to kill everything.
Yes. No, I agree. Is there anything else about working with children that we didn't touch on? Because I know every child can be different. You mentioned some things that you've noticed with children generally, that, that if they're more in touch and more in touch with their health, they may be just more curious and trusting, more able to tolerate just lying down and following, your direction.
Yes. Healthy children, happy children, they really accept you even if you are a foreigner, a strange guy, adult, but they look at you, they are curious. And I have the sense that this is a primary feeling of health, of unarmored life, like you see it in the animals too, trust. And that can be very dangerous, unfortunately, because the world is not loving, the world is not soft, and they open up, they come to you like animals, they come to you open, loving, caring, and they will be crushed.
That's an interesting observation, because the way you're describing it, almost to me, it sounds like a tentative trust, meaning they'll that natural impulse to trust is there, but they're not just arms wide open jumping into your lap. They're looking at you, making sure, is that trust founded in actually you being trustworthy? Are you kind and gentle? And
you're right. That's a good observation. Yeah, that's why they scan me.
Yeah,
they really scan you.
Yeah.
And you stay there, you let them scan you, they see everything, and it's wonderful. Yeah.
The other thing that stands out about this discussion is just even hearing Aline, lie down on the couch, make faces, yell, how rare that is with an adult patient who doesn't, isn't familiar with the process. There are so many layers that block someone from just making sound, breathing, taking deep breaths, and following some of these basic directions.
Yes, but these directions have a history, a long history, and they are functional. They serve a function. For example, rolling the eyes. There are people that cry at the first moment they roll their eyes. There are people that begin to have content. What is this shit that you are doing to me? Or something like that. So every one of these directions that you give are movement of the muscular armor, and they touch something from you, and you observe how they react. And there are many that don't react at all, so they don't feel nothing. These are pretty difficult patients, but you can go also with them.
Yes.
And be very interesting with them too.
Yes, yes. Yeah, I've just noticed that with children, there's just so much less that gets in the way of just being able to, breathe and look at a pen light and move their eyes.
I must say that treating small children until they are 5, 6 years old, it's wonderful, because there is not lots of psychology. It's very direct. The river has diverted only few months ago or few years ago, so you are near something primary. Then later, if they bring you a child with 8-year-old, it's more difficult. There is already a layering. There is hypocrisy, there is shyness, there is a lot of secondary deviation of the river that makes them almost look like adult, with their layering that needs a lot of time to dissolve.
Yes, that's. Dr. Foglia, this has been a wonderful discussion, and I really appreciate you presenting your treatment with Aline. Anything else you'd like to let the audience know before we stop?
I want to really point out this discovery of Reich, the distinction between primary and secondary emotion. Nobody make this distinction, and this distinction is essential. With little children, even more. But then later in the adolescence, it's also very important. So this is something that I would like the audience to keep in mind. The transformation and the distinction between primary and secondary emotion.
Thank you, Dr. Foglia.
Thank you.
Thank you to the audience for joining us today, and a special thank you to the donors of the ACO who make our work possible. I hope you join us for our next webinar, which will be on Saturday, October 14th at 4 p.m. Eastern Time. I'll be presenting Like Mother, Like Daughter. Dr. Edward Chaska will join me and host. In the meantime, I hope you'll check out our podcast, A Different Kind of Psychiatry podcast, and you can check out the Journal of Orgonomy, and that's now on Substack. Thank you.